All right, I'm about to start our meeting, and I'd like to thank everybody for being with us this evening. Due to public health issues arising from the coronavirus situation, the Sussex County Board of Chosen Freeholders will conduct this meeting remotely via a conference call. Callers are invited to listen and will have an opportunity to make comments by calling 973-310-7191. This is the Freeholder meeting of November 10th, 2020 at 6 p.m., regular business via conference call. Terry, I'd like to call this meeting to order. A roll call, please.
Freeholder Fantasia.
Here.
Freeholder Fasano.
Here.
Freeholder Hertzberg.
Here.
Freeholder Director Patillo.
Here.
And Freeholder Yardley.
Here.
Thank you. Would you please stand with us for a moment of silence and a salute to the flag? I pledge allegiance to the flag of the United
States of America,
and to the republic
for which it stands,
one
nation, under God,
indivisible,
with liberty and justice
for all. Thank you very much. We are starting on number 4 with a public statement. Pursuant to the Open Public Meetings Act, Chapter 231, PL 1975, adequate notice as defined by Section 3D of Chapter 231, PL 1975, has been made by regular mail and email. Such notice being submitted on January 2nd, 2020 from the Administrative Center of the County of Sussex, located at 1 Spring Street, Newton, New Jersey, to the following: New Jersey Herald, New Jersey Sunday Herald, Star Ledger, WSUS Radio, WNNJ Radio, and is also posted on the bulletin board maintained in the Administrative Center for Public Announcements and has been submitted to the Sussex County Clerk in compliance with said act. Number 5 is approval of the agenda. Before we approve the agenda, I would like to read something. A letter was just recently received from our legislative delegation in reference to the Reproductive Freedom Act. Based on the concern expressed by District 24 legislators, Senator Orho, Assemblyman Hal Wirtz, and Assemblyman Parker Space, a resolution was prepared for our consideration tonight. When we are at item 20 on the agenda, I will read the letter and resolution. Then I will open up for freeholder comments, and then I will open up for public comment before the freeholders take a vote. With that, could I please have a motion to approve the agenda?
Fantasia, so moved.
Second, please.
Yardley, second.
Is there any discussion? Not hearing any. All in favor, please signify by saying aye.
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 Okay. Number 6 is proclamations and certificates and presentations. And tonight we have a proclamation recognizing Great American Smokeout on November 19th, 2020. Is Tracy Storm Mizuko on the line?
Yes, I am.
Okay. Thank you. Thank you very much. The proclamation is going to be given by Freeholder Anthony Fasano. So, Anthony, I'll turn it over to you.
Thank you, Sylvia, and thank you, Tracy, for all your work on this. If we were here in person, I'd call you up so we can read this proclamation, but since we're not, we're just going to have to pretend, okay? So we're going to read the proclamation. Whereas tobacco smoking is the leading cause of preventable death in the world, and whereas exposure to tobacco smoke is known to cause lung illness such as cancer, COPD, asthma, pneumonia, bronchitis, lower respiratory infections, and has been linked to tuberculosis deaths. And whereas the American Cancer Society's Great American Smokeout provides an opportunity for individuals, community groups, businesses, healthcare providers, and others to encourage people to use the date to make a plan to quit or plan in advance to initiate a smoking cessation plan on the day of the event. And whereas the goals of this annual event is to challenge people to stop smoking and to help them learn about the many tools they can use to help them quit and remain smoke-free. And whereas the Great American Smokeout has helped change attitudes about smoking, which has led to community programs and smoke-free laws that are now saving lives. Now therefore be it resolved that the Sussex County Board of Chosen Freeholders does hereby proclaim that November 19th, 2020 is the Great American Smokeout Day, and together with the Center for Prevention and Counseling recognizes that addiction to nicotine and tobacco products, including electronic cigarettes, is one of the strongest addictions one can have. And be it further resolved that the Board of Chosen Freeholders encourages all Sussex County residents to recognize this day as an opportunity to live healthy, smoke-free lives, not just for a day, but all year round. By the order of the Board of Chosen Freeholders, Sylvia Patillo, Freeholder Director, Dawn Fantasia, Freeholder Deputy Director, myself, Josh Hertzberg, and Herb Yardley as Freeholders. Thank you.
Thank you very much, Anthony. Tracy, I just want to thank you for all that you do. I know there's a lot of work going on. It's difficult to do it by phone, but you do such a great job over there. I just want you to know how appreciative we are of everything that goes on over there at the Center for Prevention. So thank you so much for being a part of this call. I'd like to take a motion. Okay. Tracy, would you like to speak?
Yes, I would just like on the behalf of the Center for Prevention and Counseling and also the statewide initiative Tobacco Free for a Healthy New Jersey, I would just like to take the opportunity to thank the Board of Chosen Freeholders for passing this proclamation and recognizing the importance of Great American Smokeout. Thank you very much.
Thank you. Any freeholders would like to comment? Okay, not hearing any, could I please have a motion to accept the proclamation as read?
Fantasia, so moved.
Second?
Hertzberg, second.
Is there any discussion? Not hearing any, all in favor, please signify by saying aye.
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 Thank you. And again, Tracy, thank you so much for being on the call.
Thank you so much.
Number 7 is public hearings. We do not have any this evening. So number 8 is a public session from the floor. Tonight, there are 2 public sessions. The first one that we're about to enter into now is only on things that are on the agenda. So if you want to make a comment on something that is on the agenda, then you can speak about that at this public session. If you're here for item 20, which is the resolution about the reproductive freedom bill, that will be later on in the meeting. And then there will be a comment period again later on for anything that you want to speak about. So let's start with this session. It's for questions or comments pertaining to the agenda items only. Before we open this session, we are asking callers who want to make a comment to first state their name and their municipality. The clerk will create a list and call each in the order received, and comments are limited to 3 minutes or less. So could I have a motion to open the floor for public comment on agenda items only, please?
Fantasia, so moved.
Second?
Second, Hertzberg.
Okay, is there any discussion? All in favor, please signify by saying aye.
Aye.
Aye. Floor is open to the public. Terry, would you call names, please?
We need to accept them first, if there's
That's
anyone out there.
Yeah.
Okay, Randy Opitz, Hopakon.
Gracie Boyle, Hopakon.
I'm sorry, your first name, second caller, was it Tracy?
Yes.
Okay. Hold on just a minute. If you're here to talk on the resolution, that is not during this comment period. Okay, there's going to be a comment period when we get to number 20.
Okay.
Okay, so I know the two of you, and I know that you want to speak on that. So this is only on agenda items only, and the resolution's not on the agenda. It's coming up under legislative work under new business. So I will announce that opening as soon as we get to number 20, okay?
Okay.
So is there anyone online who just wants to talk about something that is on the agenda? Okay, not hearing anyone. Can I have a motion to close to the public?
Fantasia, so moved.
Is there a second?
Yardley, second.
All in favor, please signify by saying aye.
Aye.
Okay. Actually, at this meeting, there will be 3 places for open public comment, but they're a little bit later in the agenda. But thank you all for being here tonight. Number 9 is we're on freeholder comments. So I'd like to begin with Freeholder Anthony Fasano.
Thank you, Director Patillo, and thanks to all who are joining us this evening. I'll keep my report short. I do have a few updates tonight, but I first wanted to express my gratitude and appreciation to our poll workers, our Board of Election personnel, and the Sussex County Clerk's Office for all of their continued efforts. I know not all the results are in just yet. There are still votes being counted, but I know those folks have been working diligently, and it is very much appreciated. Tomorrow is Veterans Day, of course, and I wanted to thank all of our military veterans for their service and their sacrifice. It was so cool to be just a very small part of the 20th annual Sussex County Salute to Military Veterans. If you haven't seen that yet, that video is available right on our website. Thanks to all who are a part of that. I think it speaks to just how proud we are to have the military veterans that call Sussex County home today. Without your sacrifice, we wouldn't have the greatest country that we have today. So to our men and women in uniform, past, present, and future, God bless you and thank you for your service. At our last meeting, I was happy to announce Sussex County's latest tool, an important tool in our fight against COVID-19, with at-home COVID-19 testing now being available countywide. That information is now available right on the homepage of our county website. In cooperation with LabCorp, at-home tests are now available to all county residents over the age of 18 at no charge. Residents can simply go online, complete a short eligibility survey, choose whether to bill your insurance or utilize federal funds to cover the cost of the test, receive your kit, take your sample, send it back, and see your results typically online within 24 to 48 hours, along with email confirmations. This test is a painless nasal swab, and the process is designed to be quick and easy. This program is crucial to Sussex County's efforts in the coming months as it greatly expands access to testing and convenience for our residents. And speaking of important tools, our local businesses need our support, especially as we head into the cooler months ahead. And I wanted to remind our residents and our businesses of our collaborative interactive business map, which is available right on the county website as well. This interactive map was developed by the county in partnership with the Sussex County Chamber of Commerce and the Sussex County Economic Development Partnership. And it is designed for every business within the county to list its information, its reopening status, and any other useful information so that our residents know when and how they can support their favorite local businesses here in Sussex County. And finally, I'm thrilled to announce tonight another important partnership for Sussex County, a creative one designed to expand transportation options for our residents and expand hours of transportation service into the evenings and the weekends, especially for those who need to get to critical medical appointments or employment opportunities. This has been in the works for a while, well before I got here. I know a lot of effort has been put into this by our staff and former freeholders, and I'm so appreciative of everyone's efforts on this because I think it is so important. Thanks to a grant received by the Sussex County Skylands Ride through New Jersey Transit, Sussex County will now be adding the services of a transportation networking company pilot program in partnership with TransOptions. This enables TransOptions to arrange and secure transportation for Sussex County residents at no cost to them by utilizing rideshare services such as Lyft and Uber. This grant covers the total cost of the ride for the passenger, and it is expected to start this Monday, November 16th, and it extends to the end of the year with the possibility of extending into next year. That's certainly our hope. Sussex County residents can call the main Skylands Ride Transit office number to book a trip, which is at 973-579-0480. Trips that cannot be accommodated through our regular services, such as our Public Connect service or our Demand Response service, or are beyond those usual working hours, will be screened for this TNC pilot program. Residents can request a ride in advance, such as in the evenings or the weekends for employment or important programs or medical appointments. And Skylands Ride will also have a supervisor on call just in case there is a canceled ride to prevent any residents from being stuck or not being able to get back to home. This is an important step into the 21st century for Sussex County's transportation infrastructure, and although it accomplishes an immediate short-term goal of immediately helping residents in need of important rides, it also makes a huge impact in our longer-term goal to increase the capacity of Uber and Lyft drivers in Sussex County in order to expand this program and ultimately to benefit all Sussex County residents at all times. More information will be forthcoming online, and I again just wanted to thank all of those involved on this. I think this has tremendous potential for us, and I'll continue to share updates as they come along as well. So thank you, Director Patillo, and that concludes my report for this evening.
Thank you very much. Freeholder Josh Hertzberg?
Yes, thank you. So I'll start where Anthony left off. I was actually on the NJTPA meeting 2 days ago, and there's a couple of the things that we voted on. Speaking of the Skylands Ride and some of the work that's being done by TransOption, which I'm also a board member of, and I'm very proud of the work that they are doing in the county with us, was a good amount of funding coming to Skylands Ride to purchase some new vehicles for the county so we can expand and hopefully continue to keep that available to residents of the county. There was also some funding for some road work that was allocated by the state. And one of the things that we did not vote on, but that was also being worked on for the upcoming plan, was more allocated funds for the rail coming to Sussex County. I'm going to go ahead and work on collecting all that information so that I can present it at the next meeting, but a lot of good stuff as far as transportation coming to the county, and I think everybody will be happy with that. I want to finish off by, again, recognizing Veterans Day. I always try and do my best to thank as many of my friends and people I know that have served, but it's never enough. I'm really proud of my salute committee. If you drive through Sparta, you'll see on every light pole through the entire town banners of all the veterans from Sparta who have served, are serving, or are serving now or have served throughout the entire town. I think it's great that we show them how much we love and respect what they've done and continue to do for us. So for all the veterans out there, thank you for your service. Thank you for our freedom. And that's all I have tonight. Thank you.
Thank you very much. Freeholder Herb Yarley?
Well, thank you, Sylvia. I just want to thank all of our veterans. We'll be celebrating their day tomorrow. For everyone that served, we are honored, and my heart goes out to those that did not return. I also wanted to just take a minute to talk about the Marines. They're 245 years old today, and it's amazing. They were actually formed back in the 1700s. The Chamber has a survey, a COVID-19 business survey, phase 2, and they're looking for you to, businesses to fill that out so they can see where you're at and understand and respond to the impact of COVID-19. So if you know someone or if you're a business person, you need to go over to the Chamber and do that. That's all I have for tonight.
Thank you very much, Herb. Deputy Director Dawn Fantasia, please.
Thank you. First, I too would like to recognize our veterans a day early. Tomorrow is their holiday, and I just wanted to point out I actually am looking very forward to tomorrow at my school. I actually am having 2 individuals from our area. The first is retired Army Specialist Jason Fruge, who was in Operation Enduring Freedom. He is the Dean of Technical Operations at our Sussex County College, and he's actually going to virtually via Zoom address my students tomorrow. And the second person I have is right across the border up here in Warren County. He was first lieutenant in the Marine Corps, and he's a retired Army Major, Joseph LaBarbera. He's highly decorated. He received a Global War on Terrorism Service Medal. He served in Afghanistan, Iraq, and Kosovo, and he's going to be speaking to my students as well. So I always like the fact that our school is open on Veterans Day, because normally we would do a great big breakfast and a big in-person presentation. I know this year it's going to be a little different, but I think it's really great that we can tap the people that we know in our lives and be able to have them share their experiences with our students. So I just wanted to share that. Shifting gears a little bit, last Wednesday, the Murphy administration and state Democrats authorized the release of 2,261 adult prisoners and 50 juvenile offenders because state officials failed to protect inmates in New Jersey prisons from the spread of the coronavirus. So under law, prisoners in New Jersey could get their sentences reduced by as many as 8 months for every month spent behind bars during the pandemic. So inmates in federal prisons and county jails were not eligible. This was just state prisons. Now, this legislation allegedly excluded those convicted of murder, aggravated sexual assault, and, quote, repetitive and compulsive sex offenders, but not aggravated manslaughter and 2 weapons charges, and I'll explain. The law requires victims to be notified. And NewJersey.com reported that according to a letter from the Somerset County Prosecutor's Office, victim Robert Valentine was shot repeatedly in front of his wife and 16-month-old son while the family opened presents on Christmas Day in 1999. So the prosecutor's office in Somerset County objected to his killer's early release. He was actually convicted of aggravated manslaughter and 2 weapons charges, according to prison records. He was originally scheduled to be freed next March, but this law bumped his release up to last Wednesday, much to the horror of the victim's family. Now here's where it gets worse. Senator Michael Testa first shared an internal memo that the Department of Corrections received stating, quote, a few of the inmates to be released were COVID-19 positive. Now initially, as per this memo, the plan was to ensure transport staff was adequately protected as they should be. Yet, as per the memo, the individuals were slated to be brought to public transportation hubs. But media uproar shamed the governor into amending that plan. And once exposed by NewJersey.com, boy, did the story change. Now, there would be individualized release plans. And via email, a spokesperson stated that the 11 COVID-19 positive individuals would now receive, quote, personalized transportation plans where they would be, quote, medically isolated. So the few COVID-19 positive inmates turned out to be 11. I don't understand that math. To give you an example, if someone said, hey, what'd you do on the weekend? I had a few beers. I wouldn't think that that meant 11 beers, but I digress. But this is somewhat reminiscent of this administration's penchant for creating super spread of the virus into New Jersey nursing homes. So in typical New Jersey fashion, no sufficient communication, no time to aid these individuals into reentry, and the trend to correct errors after media leaks is very strong. So my question is this release nothing but a cost-saving measure that actually endangered everyone? Why just the state prisons? We all want to give better odds for less recidivism. But why not give agencies the proper notification so they can help reintegrate these individuals with housing, for starters? Dropping them off at a bus or train is a recipe for what I'm about to share with you from the Newton Police Department. And this is why it affects Sussex County. On November 4th, the day of the release, detectives from the Newton Police Department and the Sussex County Narcotics Task Force arrested an individual for numerous drug-related offenses right here at a residence on Halsted Street. He's a 42-year-old male from Newton, and he was charged with 1 count of distribution of a controlled dangerous substance, which was heroin, 1 count of distribution of a controlled dangerous substance, crack cocaine, and 1 count of distribution of a controlled dangerous substance within 1,000 feet of a school. This individual was released from parole supervision under Governor Murphy's new law, which reduced and ended his time on parole due to the COVID-19 pandemic. He was processed, and now he's lodged in the Morris County Jail. And this individual isn't the only one. So the state insisted that only inmates who were within a year of release were eligible to receive that time off their sentences. And those convicted of murder and some sexual offenses were not allowed early release. So imagine my surprise when the news broke that U.S. Immigration and Customs Enforcement in Newark arrested 88 inmates who had been released from prison that week as part of this release. Now, a spokesman for ICE, Emilio Daboul in Newark, said the inmates were taken into custody on Wednesday and they were all, and I quote him, violent offenders or have convictions for serious crimes such as homicide, aggravated assault, drug trafficking, and child sexual exploitation. So is the Trenton motto, why provide adequate health care when you can rid yourself of all accountability? Act now, we're going to put the fire out later. So we release COVID-positive inmates into the populace with no initial plan, just like we pushed COVID-positive and COVID-unknown patients into nursing homes that were ill-prepared to handle such care. And don't worry, we'll clean up the mess later. We deliver 17 body bags to Andover subacute and rack up a morbid total of 7,000 deaths in New Jersey across the state. I'm tired. I'm tired of trying to make sense of this. This isn't even partisan at this point. This is just plain stupid governance or a lack thereof. This creates nothing but distrust in the New Jersey Department of Health. These are the alleged experts, the ones supposedly that are going to keep us safe, the champions of humanitarianism, and there's absolutely no excuse for this sloppy hot mess that's spilling out of Trenton. And advocacy groups were scrambling all over the place to help the best they could that day, and God bless them for their efforts. And for the record, New Jersey is the only state in the nation to do this, according to the ACLU. Of course we are. And so, you know, inmates will continue to have sentences reduced as long as the, quote, public health emergency remains in effect. Governor Murphy's office previously estimated another 1,000 inmates are going to be released early in the following weeks through the month of January. So here you have it, folks, Governor Murphy's stronger and fairer New Jersey. I have the COVID update for us for the county. So in a county with a population of 140,000, thus far 54,262 county residents have received and reported a test for COVID-19. So that's a little more than 38% of county residents have been tested. 2,116 tests have been reported as positive cases for a positivity rate of 3.89%. Of those positive cases, 1,720 have been classified as recovered. So our recovery rate's at 81%. 198 cases are under investigation currently, and there are also 198 deaths for a rate of 9%. Now, we did not have a death in the month of November. There was one death reported on October 30th, and prior to that, August 14th was the last death prior to that. So in nursing homes right now in the county, there's 489 positive cases, or 23.1% of our positive cases originate in the nursing homes, and 115 fatalities, or 58% of the county's fatalities are from our nursing homes. In the month of November, there's been a total of 3 hospitalizations, and in our prior month, there were 14 hospitalizations, but one of those was actually a Pennsylvania resident that was hospitalized here in Sussex County. So I want to give you a little bit of clarification from the epidemiologist as to where the trends are going now in the county. We received some frequently asked questions, and she puts this together. So multiple cases in the county are linked to individuals under the age of 18. A majority of those individuals are presenting as asymptomatic, so they are tested because they're identified as close contacts with somebody who's COVID positive. Most cases are school-related, school activities or school sports-related, or traced to social gatherings of school-aged children. So there's multiple household clusters originating as a result. There's also positive cases related to in-county and out-of-county places of employment. So there's positive cases linked to other counties. So if we have residents that work outside the county, as well as positive cases of individuals residing in different counties who are working in Sussex County, they're being passed back and forth, but the cases are actually investigated by the place of the individual's residence to begin with. At this time, the Sussex County Department of Health is not aware of any positive cases related to a political rally held at Skyline Stadium in Frankfurt on the 14th of October. Cases are investigated and close contacts are traced 7 days a week by our public health nursing. There's also, if you look online, there's a new report sheet that's been added to our weekly reports. It's a slide that's COVID-19 related hospitalizations by date of admission. So that's a helpful piece. A lot of members of the public were asking for specific hospitalization data broken down. So I was very happy in speaking with Greg and with Carol, and they were able to have that information added to the report from our epidemiologist. And If you have any further questions, you could always contact the Sussex County Division of Health. Their office hours are from 8 to 4:30. Their phone number is 973-579-0370, and you can email them at health@sussex.nj.us. Thank you.
Thank you very much, Dawn. I would also like to really express my appreciation to the Board of Elections and all of the volunteers that came in to count these paper ballots. This has been a long and tedious process. I also would like to thank Jeff Parrott, our county clerk, and his office, who added great support in getting all of this together. Hopefully by the end of the week, we expect to have everything completed, all the ballots count, and the totals ready to go out to the public. Veterans Day is tomorrow, and it's a special day to honor all of our veterans. Normally we have a parade at the fairgrounds, which I really missed this year, but because of COVID, we had to do it virtually. But I'd like to thank all of our veterans. I just greatly appreciate my freedom more so than ever before. They are just a very special, wonderfully dedicated people that have just served the country with honor, and it's been a pleasure to meet so many veterans. And I just want to thank all of you for your service. I'd like to speak a little bit on Skydance Ride tonight. Sussex County Skydance Ride will resume a modified weekday Public Connect schedule on Monday, November 16th to provide residents with access to the most needed routes. The Public Connect is heavily utilized by the working population, and we are striving to ensure that accessible transportation continues to be available for families and individuals to remain self-sufficient. To obtain more information, you can call Sussex County Skydance Rides at 973-579-0480. I also want to mention that we have a drive-through flu clinic at the Sussex County Fairgrounds on Saturday, November 14th from 9 to 10:30. Appointments are required, and you can make those on our website at www.sussex.nj.us/flu or by calling 973-579-0570, extension 1211. For our seniors, we want to ensure that our seniors receive the high-dose flu vaccine timely, so we have arranged for the following flu clinics for our seniors. Sparta Pharmacy at the Knoll Heights Senior Center from Monday, November 16th from 3 to 5, and Thursday, November 19th from 3 to 5. You can call Senior Services at 973-579-0555, extension 1285, or you can call Knoll Heights at 973-729-4311. And the other one for our seniors is at the Walgreens Pharmacy at the Apacon Senior Center. That will be on Thursday, November 19th, beginning at 12:30 p.m. Regular and limited high-dose flu vaccines free with Medicare Part B. Otherwise, pharmacy will bill insurance companies. Registration is required, and you can call our senior center in Apacon at 973-770-2701. So thank you for our comments this evening. We are going to continue with our agenda. We are now on item number 10, which is approval of consent agenda. The Board of Chosen Freeholders of the County of Sussex has reviewed the consent agenda consisting of various proposed resolutions and determined that adoption of the said resolutions is in and will further the public interest. If any freeholder would like to remove an item to be considered separately, please do so now. Is there any freeholder that would like to remove an item on the consent agenda? Okay, not hearing any, can I please have a motion to approve the consent agenda from A to M?
Fantasia, so moved.
Yardley, second.
Any discussion? Terry, a roll call, please.
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay, on number 11, the approval of minutes. I think we can do the both at the same time. So could I have a motion to approve the regular meeting of October 28th, 2020, and the minutes also from his executive session minutes from October 28th, 2020?
Fantasia, so moved.
Second?
Yardley, second.
Is there any discussion or
Second.
correction? Okay, not hearing any, Terry. I could just, all in favor, please signify by saying aye. Do a voice vote.
Aye.
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 Any appointments or extensions? No. Okay. Number 12, appointments and resignations. We do not have any this evening, so we'll move right on to number 13. We have resolutions from A to F. Can I please have a motion to adopt said resolutions A to F?
Sylvia, I don't know if we have to do that, but can I ask for A to be considered separately because I would like to abstain from A?
Okay, sure. So we can just, let's just take resolution A separately. So can I have a motion to move resolution A?
Yardley makes the resolution to consider it separately.
Okay, can I have all in favor, please signify by saying aye.
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 Okay, so
Aye.
that was just a motion to
I'll-
take it separately. So now let's take it separately. Now can I have a motion to approve just resolution A?
Yardley, I make the motion.
Okay, second?
Hertzberg, second.
Okay. Is there any discussion on A? Not hearing any. Cherry, could we have a roll call vote on A, please?
Freeholder Fantasia,
Abstain?
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
All right, now can I have a resolution to move a resolution B to F?
Fantasia, so moved.
Second, please.
Yardley, second.
Any discussion? Terry, a roll call?
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay, we're now on number 14, awards of contract, change, orders, and bid. The Board of Chosen Freeholders of the County of Sussex has reviewed the award of contract, change orders, bids consisting of various proposed resolutions and determined that adoption of the said resolutions is in and will further the public interest. Can I please have a motion to approve contracts A through F?
Fantasia, so moved.
Yardley, second.
Is there any discussion? A roll call vote, please, Terry.
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Okay, we are on number 15, to pay the bills. So A, resolution, payment of bills, November 10th, 2020. May I please have a motion to approve the bill list?
Fantasia, so moved.
Second? Second,
Yardley,
please.
Second, Anthony.
Is there any discussion? Not hearing any. Cherry, can I have a roll call vote?
Freeholder Fantasia,
Yes.
Freeholder Fasano,
Yes.
Freeholder Hertzberg,
Yes.
Freeholder Director Patillo,
Yes.
Freeholder Yardley.
Yes.
Now for 15B, we have an introduction for first reading, ordinance 20-06. Bond ordinance providing for the undertaking of 2020 capital improvements at and for certain facilities of Sussex County Community College located within the County of Sussex, State of New Jersey, appropriating $2.8 million, therefore, and authorizing the issuance of $2.8 million of bonds or notes of the County of Sussex, State of New Jersey, for financing such appropriation, the principal and interest on the aggregate principal amount of which will be entitled to state and pursuant to Chapter 12 of the laws of New Jersey of 1971. I would like a motion to adopt this ordinance on first reading and authorize the clerk to advertise this ordinance as introduced for first reading and also post same on the bulletin board in the lobby of the County Administrative Center together with a notice of public hearing stating that a hearing will be held on November 24th, 2020 at 9 a.m. prior to final adoption of this ordinance. May I please have that motion?
Fantasia, so moved.
Second, please.
Hertzberg,
Yardley,
second.
second.
Okay, any discussion?
Yes. I don't know, Sylvia, if you would like to explain or whether we would ask Greg to explain how this is back on the agenda and the situation with Chapter 12 funding in the state of New Jersey.
Sure, Greg is right here.
Just briefly, the county was advised earlier this year that the Chapter 12 capital project financing program, as sponsored by the state of New Jersey, was being suspended. As a result, the county decided not to move forward and, in fact, had canceled an ordinance that it previously had considered, which would have authorized the capital project financing under the 2020 Chapter 12 program. For the public's benefit, this is monies that are split between the county and the state at 50%. To provide for capital project financing at the community college. Just recently, we were advised that the state was reinstating the Chapter 12 capital financing program for our fiscal year 2020, and the board's consideration of the introduction of this ordinance will allow for the financing of projects identified and authorized by the Board of School Estimate in 2019.
Are there any questions?
No, I would just like to add that I myself was a member of the Board of School Estimate in 2019. One of the projects of note is the HVAC system and the ventilation at the Public Safety and Training Academy and other buildings among spread out throughout the campus, and I just wanted to point out the importance of having those projects done specifically now when air quality, specifically indoor air quality, is so important with, spread of any type of infection. So I think it was timely that the money was made available again, and hopefully we can move forward on these projects, as swiftly as possible.
Absolutely. Thank you so much, Dawn. Any other discussion, comments? Okay, not hearing any. Terry, can I have a roll call, please?
Yes. Freeholder Fantasia?
Yes.
Freeholder Fasano?
Yes.
Freeholder Hertzberg?
Yes.
Freeholder Director Patillo?
Yes.
Freeholder Yardley?
Yes.
Okay, we are on number 16, and it's personnel. We have a resolution authorizing personnel agenda of November 10th, 2020. Can I please have a motion to adopt the personnel agenda?
Fantasia, so moved.
A second, please.
Yardley, second.
Any discussion? Okay, not hearing any. Terry, can we have a roll call vote, please?
Freeholder Fantasia?
Yes.
Freeholder Fasano?
Yes.
Freeholder Hertzberg?
Yes.
Freeholder Director Patillo?
Yes.
Freeholder Yardley?
Yes.
Okay, at this time we are at number 17, and our Business Administrator, Gregory Puff, has an administrative report.
Just a few quick things. One, I'm very pleased to report that the county's application to the state for the Library Construction Bond Grant Program has been recommended to the state legislature for final approval. So that was very good news. I would like to thank the board for their support of that application. We wait for final passage by the state legislature of those grants, but very pleased to say that Sussex County was given favorable consideration on that application in the first round of those grants. So that's a very significant item for the county. And again, thank you to the board. Secondly, as touched upon in the freeholder comments, we are very much aware of increasing COVID-19 infections across the county. I have been in contact with the county's epidemiologist as well as our Division of Health and COVID coordinator within the Division of Health. We are continuing to engage with a variety of stakeholders to make suggestions and recommendations as to how we might best provide the relevant interventions to allow us to bend the curve and flatten it. We do anticipate at this point that we will continue to see these numbers increase over the next few weeks, but we are taking a proactive approach in trying to identify where those infections are occurring and then communicating with those various stakeholder groups. Last, I would just also like to acknowledge Veterans Day, and particularly my favorite veteran, which is my grandfather, Vance Harvey Poff, who is a World War II veteran at the ripe age of 94, still with us, and really a very remarkable person, having served in the infantry in Germany and was the recipient of 2 Purple Hearts. So I'd just like to take a moment to recognize him for his service to our country and thank all of our veterans and ask that everyone take a moment tomorrow at the appropriate time to remember their service and sacrifice. Thank you.
Thank you very much. We are at number 18. We do not have a report for our council. Number 19, does anyone have any unfinished business? Okay, not hearing any. We'll go to number 20, which is our new business about state legislative matters. And I spoke about this at the beginning before we approved our agenda, that we received a letter from our District 24 legislators, and I'd like to read that letter about the Reproductive Freedom Act. After I'm done reading the letter, I am going to ask Deputy Director Dawn Fantasia to read the resolution to oppose the pro-abortion, pro-sex trafficking bill, which is S-3030 and A-4848. And then I will open it up to the public. I know people have waited patiently to speak on this bill. And as soon as we hear the resolution, the freeholders will discuss it, and then we will open to the public comment. So thank you for being so patient with us. I'm going to read the letter now. Dear freeholders, we are writing to you about a dangerous and wide-ranging bill working its way through the New Jersey legislature. Its proponents call it the New Jersey Reproductive Freedom Act. It was introduced last month in the Senate as S-3030 and in the Assembly as A-4848. This legislation runs counter to the most up-to-date medical knowledge and pushes an agenda that is badly anti-science. As written, S-3030/A-4848 ignores the established medical consensus on fetal pain and viability to allow abortions up to the moment of birth. All abortions, including late-term abortions, will be allowed throughout the entire 9 months of pregnancy. This bill enshrines in law that living babies in the womb capable of feeling pain have no right at any stage of pregnancy, even if they are viable and at full term. Then it goes even further. S-3030/A-4848 exempts from prosecution those who are caught terminating or attempting to terminate the individual's own pregnancy, or acting or failing to act in any manner with respect to the individual's own pregnancy, based on the potential or actual impact on the individual's own health or pregnancy. This bill guts the New Jersey Safe Haven Infant Protection Act, which has saved the lives of dozens of newborns since its enactment. The bill eliminates the requirement that a medical legal death investigation be conducted in a case where a fetal death occurs without medical attendance. This bill will grant immunity from prosecution for so-called prom mom cases where infants have been born alive and left to die, or through a deliberate act. This bill follows this up with a direct attack on the scientific community and the medical profession. This legislation invalidates existing laws and prohibits the future adoption of all laws, rules, regulations, ordinances, resolutions, policies, standards, or parts thereof that conflict with the provision of the bill. Therefore, it not only negates the current scientific standard, it blocks the advice of science in the future and prohibits taking science into account in the future. Then it takes aim at the medical profession by expressly invalidating all rules and regulations promulgated by the New Jersey Board of Medical Examiners with regards to regulations that apply to abortion. This radical legislation goes even further by permitting non-physicians to perform abortions. Where once an argument for abortion was a concern about so-called black alley abortions, this legislation opens the door to just that. S-3030/A-4848 is an assault of religious liberty and freedom of conscience. This bill invalidates New Jersey's Conscience Clause that has been in effect since 1975 and which protects the right of individuals to refuse to perform or assist in abortion procedures. The legislation requires all insurance carriers to provide coverage for abortions and expands coverage for contraceptives to a long-term supply of up to a year at a time. Under this legislation, parents will have no say in the physical and mental well-being of their children. To top it off, if a religious employer asks for an exclusion because the required coverage conflicts with the religious employer's religious beliefs and practices, state bureaucrats get to determine whether or not, in their opinion, the religious or conscientious objector is valid. This bill is anti-taxpayer. The bill literally subsidizes the abortion industry and mandates an annual allocation of taxpayer funding for Planned Parenthood under Title X in the state budget. The bill explicitly guarantees to every individual the fundamental right to reproductive autonomy, which includes the right to contraception, the right to abortion, and the right to carry a pregnancy to term. Most importantly, the bill applies to all residents and those who come to this state, including those who are incarcerated. Under this bill, taxpayer-funded abortion will cover everyone from illegal immigrants to prison inmates. In fact, anyone with a way of getting into New Jersey, whether by bus, automobile, boat, or airplane, will have access to taxpayer-funded abortions, contraception, and pregnancy care. Given New Jersey's sanctuary state policy, experts in human trafficking and sexual exploitation are concerned that New Jersey could become a taxpayer-paid for hub for sex traffickers looking for a subsidized way to provide for the victims of modern-day slavery. S-3030/A-4848 is bad legislation. Even those who support abortion recognize the bill's dangerous overreach. We ask that the members of the Sussex County Board of Chosen Freeholders pass a resolution in opposition to S-3030/A-4848. Thank you for your time. Sincerely, Assemblyman F. Parker Space, Senator Steve Oraho, and Assemblyman Harold Wirth. At this time, I'm going to ask Deputy Director Dawn Fantasia to read the resolution for our consideration tonight. Dawn?
Thank you. Whereas the New Jersey Reproductive Freedom Act was introduced in the Senate on October 8, 2020 as S-3030 and in the Assembly on October 20th, 2020 as A-4848. Whereas S-3030/A-4848 will make New Jersey a destination for those seeking abortion without restriction, promote human trafficking, and create an unreasonable financial burden on New Jersey taxpayers by explicitly guaranteeing, quote, that financial barriers do not prevent anyone from making their own personal health decisions when it comes to birth control and pregnancy-related care, including abortion, end quote. The bill will apply to all residents and those who come to this state, including those who are incarcerated or present in the state illegally. And whereas S-3030/A-4848 will permit all abortions, including late-term abortions, throughout the entire 9 months of pregnancy. And whereas S-3030/A-4848 enshrines in law that living babies in the womb capable of feeling pain have no rights at any stage of pregnancy, even if they are viable and at full term. The bill specifically states that, quote, a fertilized egg, embryo, or fetus shall not have independent rights under the laws of this state, end quote. And whereas S3030A4848 invalidates existing laws and prohibits the future adoption of all laws, rules, regulations, ordinances, resolutions, policies, standards, or parts thereof that conflict with the provisions of this bill. And whereas S3030A4848 removes medical community oversight by expressly invalidating all rules and regulations promulgated by the New Jersey Board of Medical Examiners, which regulate and apply exclusively to termination of pregnancy. And whereas S3030A4848 puts women in danger by permitting non-physicians to perform abortions and restricts individual freedom of choice by invalidating New Jersey's Conscience Clause, which has been in effect since 1974, which protects the right of individuals to refuse to perform or assist in abortion procedures. And whereas S3030A4848 voids the New Jersey Safe Haven Infant Protection Act by exempting from prosecution individuals charged with terminating or attempting to terminate the individual's own pregnancy or acting or failing to act in any manner with respect to the individual's own pregnancy based on the potential or actual impact on the individual's own health or pregnancy. The bill eliminates the requirement that a medico-legal death investigation be conducted in a case where a fetal death occurs without medical attendance. Such language grants immunity from prosecution for cases including, but not limited to, the, quote, prom mom, end quote, where infants have been born alive and left to die or through a deliberate act are killed. And whereas S3030A4848 imposes an undue financial burden on taxpayers by mandating an annual allocation of taxpayer funding of Planned Parenthood, a private entity, under Title X in the state budget. Whereas S3030A4848 will impose higher premiums on health care for state residents by requiring all insurance carriers to provide coverage for abortions. And whereas S3030A4848 gives the state the power to define what is or isn't a religion by requiring religious employers to request an exclusion from abortion-related health care coverage if the required coverage conflicts with the religious employer's religious beliefs and practices as determined by the state. Therefore, be it resolved by the Board of Chosen Freeholders of Sussex County that we oppose the passage of S3030A4848 and urge the New Jersey Legislature to oppose this legislation. A copy of this resolution will be sent to New Jersey Governor Philip D. Murphy, each member of the New Jersey State Senate and New Jersey State Assembly, to the boards of chosen freeholders in each of the other 20 New Jersey counties, and to each municipal governing body in the County of Sussex. Sylvia, are you going to open for discussion?
Dawn, can you open it for discussion?
Yes, I guess I'm not sure if Sylvia dropped off the call.
Sorry, I'm on mute, so I just said all of that to myself. Excuse me, it's been a long evening. At this time, I'm going to open it up for discussion for the freeholders, and then I'm going to open it up to the public for their comments. So I just want to thank everybody for being so patient. And I'm sorry I didn't see that I had the mute button on. So I'm going to begin with Freeholder Anthony Fasano, please.
Thank you, Sylvia. And quickly, I just want to thank Senator Oroho, Assemblyman Space, and Assemblyman Wirtz for their letter updating us on this radical and flat-out bad legislation working its way through New Jersey's legislature at warp speed, which is typically never a good sign, but in this case, it is particularly egregious. This bill allows abortions up to birth. Taxpayer-funded abortions are covered for everyone, regardless of if you are from this state or even from this country. It will grant immunity from prosecution to cases where infants have been born alive and left to die. It destroys the New Jersey Safe Haven Infant Protection Act, which has already saved dozens of newborns. It pays no mind to religious liberty and freedom of conscience. It brings real concerns from experts in human trafficking. And perhaps most shockingly of all, it prohibits the future adoptions of all laws, rules, regulations, ordinances, resolutions, policies, and standards that conflict with the provisions of this bill. This is crazy. It's unsustainable. It's overreaching. And I support the efforts to oppose it, and I thank the senator and the assemblyman for theirs as well. Thanks.
Thank you. Freeholder Josh Hertzberg, please.
Yes, thank you, Sylvia. I'm not going to reiterate all the points that have been made several times, but it is crazy to me that legislation like this, one, would even be pushed, but two, to try and be pushed so quickly so as to sneak it in is just egregious. And, like you said, Sylvia, even people that support abortion look at this and I've talked to several people, several of my friends who are Democrats, and I've yet to find one who agrees with some of the most egregious parts of this bill. So, I'm glad and I'm thankful for our legislative personnel and Steve and Hal and Parker for vehemently opposing this and bringing it to light. So that's all I have. Thank you.
Thank you very much. Freeholder Herb Yardley.
I want to thank Senator Ora Howarth and Parker Space for making us aware of this bill. I just have to agree with Anthony and what he said and explained here. This is an egregious bill. To have a child being born and being delivered, and you're able just to reach in and snuff out that life. When I explained this to some of my friends, they just couldn't believe that that would happen, or that you could literally terminate a child at 9 months. So I am against this bill, and I will appropriately vote on the resolution to send it out. And I don't think I need to say much more than that. Thank you.
Thank you very much. Deputy Director Dawn Fantasia.
Thank you. Well, first of all, the egregious nature of this being shoved through legislation is just incredible to me. But for the basis of context, I want to address a couple of the points in the letter from D24. The state has a website that's dedicated to the New Jersey Safe Haven Infant Protection Act, and on that site I found the following information. So according to national statistics from 1991 to 1998, child abandonment in public places increased 62%. Of the 105 children abandoned in public places in 1998 alone, 33 were found dead. In New Jersey, there were dramatic accounts in the newspapers, and television underscored the problem. In November 1996, New Jersey residents attending college in Delaware dumped their newborn into a motel trash bin, and in June of 97, a teen gave birth in a public bathroom stall next to where her high school prom was being held. She wrapped the baby in a garbage can liner, put it in the trash can, returned to her prom, and in both cases, the babies died. But since the inception of New Jersey Safe Haven Infant Protection Act, 76 infants have been safely surrendered. The site has a frequently asked questions section and information on guidelines and locations. So it's very helpful. I suggest you take a look at that. Overall, I understand that our society has divergent views regarding the morality and the legality of abortion, but most U.S. states and the global majority have come together to address the evidence for fetal pain and the practice of aborting a viable fetus in the third trimester and up to the date of delivery. So as a matter of fact, the United States is one of only 7 countries that allows on-demand abortions past 20 weeks. The other countries are North Korea, China, Vietnam, Singapore, the Netherlands, and Canada. Other than that, it is prohibited or has limitations. So there's been some other legislation that has been introduced at the state level and at the federal level. So In New Jersey, there was the Pain Capable Unborn Child Protection Act. That was legislation that in most cases would make it unlawful to perform an abortion if the estimated post-fertilization age of a fetus was 20 weeks or more. Proponents of the bill have stated that science has proven that at 20 weeks, the infant actually feels pain. Yet again, we are one of only 7 countries that still allow abortion after this point. The bill includes exceptions for rape, incest, or to save the life of the mother, would end this at-will practice. The bill was modeled after federal legislation supported by Senator Oroho and D24. It was intended to address the exact concern that an unborn child is capable of experiencing pain by 20 weeks after fertilization. So how that's even established, surgeons in the field of maternal and fetal medicine have found it necessary to sedate an unborn child to prevent the unborn child from engaging in vigorous movement when there is invasive surgery in utero. So there was a study done in Spain at the Hospital Virgen del Rocío where surgeons spent a decade doing open fetal surgery. And actually in 2007, they performed the first intrauterine spina bifida operation in Europe. And in this one specific case, the fetus was unable to receive IV anesthesia from the start of the operation. So Dr. Javier Rivas, who is head of the infant neurosurgery unit, stated, and I quote him, "It was at that moment that our monitoring teams detected anomalies in the behavior of the fetus, which led the doctors, surgeons to believe that this was effectively a reaction to the stress caused by pain. We quickly put in place the anesthesia protocol, and the spinal reconstruction was possible, and the post-op period passed without any problems." So some problems with this bill also goes over into the legal. The bill fails to recognize personhood all the way up to the date of delivery. Now, if you remember, President Bush signed the Unborn Victims of Violence Act on April 1st, 2004. So that bill recognized that when a criminal attacks a pregnant woman and injures or kills both her and her unborn child in the commission of a federal crime, that they've actually claimed 2 human victims. So it established that a child in utero allows the assailant, so if the child is killed in utero, the assailant may be charged with a second offense on behalf of the second victim, the unborn child. So the law applies to the 2-victim principle to 68 existing federal laws that involve violence against women. This is interstate stalking, kidnapping, bombings, major drug trafficking, attack on federal employees even. But this law doesn't apply in states like New Jersey, which do not have any fetal homicide law in effect. And then there was another one, so that made it not far in the state of New Jersey, did not get majority support. Then there was another bill, the Motherhood Violence Act. So this was to address the intentional killing of an unborn child for criminal homicide. So in New Jersey, on March 3rd, 2016, it was introduced into committee, made it 25% of the distance as per the state legislative webpage, and quite ironically, the language used is it said it, quote, died in committee. So that very same month, in March of 2016, in South Jersey, a tree topped by a bald eagle nest was illegally cut down, smashing 1 or more eggs inside. So according to the Department of Environmental Protection, the adult eagle pair was not injured, but destroying an eagle nest intentionally carries a fine up to $5,000 and a year in prison. So my point is, New Jersey has laws that have zero legal congruity. So destroying an eagle is illegal because they're endangered, right? So destroying an eagle egg is illegal because eagles are endangered. Henceforth, the reason it's illegal is because what's inside the egg is an eagle. So if you destroy the eagle egg, you're destroying an eagle, and you can face prosecution. So this bill negates the personhood or the existence of a child. So to say an unborn human has no rights because it's not technically a human isn't congruent with the eagle example. So under that argument, inside the eagle egg, there's no eagle. So we can go around smashing eagle eggs without penalty. But we all know that that's not the case. And so if you take religion aside and morals aside, and we're just legally speaking, if an unborn eagle is an eagle, an unborn human is a human, period. So New Jersey consistently presents with so many inequities around reproduction. For instance, a school cannot dispense over-the-counter medication, Tylenol, Advil, to a child without explicit parental signed consent. Okay? Yet New Jersey doesn't require parental consent currently for a medical abortion, but this bill doubles down, and now your child, your daughter, can have an abortion from a non-physician, and you don't know. So this isn't even a doctor performing this procedure on your child. So overall, in my opinion, this bill furthers the absolute extreme. I cannot in any way support this legislation. I agree with D24. And this and our sentiments this evening no doubt will be twisted, mischaracterized as religious zealotry, et cetera, et cetera. But I'm sorry, ask the rest of the planet. This bill is absolutely inhumane. My guess is every single country across the globe, except North Korea, China, Vietnam, Singapore, and us, thinks that something like this is acceptable. So I am absolutely opposed to this. And that's what I have. Thank you.
Thank you very much, Dawn. There is a book called Won by Love, and it's about a woman named Norma McCorvey. Norma McCorvey is also known as Jane Roe of the infamous Roe versus Wade abortion decision. In her book, she made a comment that I found very interesting. She said, even though I allowed my name to go on the affidavit that resulted in the dismantling of every state's laws restricting abortion, I was never very comfortable with the act of abortion itself. In fact, the truth be told, Jane Roe never aborted a baby. She had her baby, and she gave it up for adoption. So the Supreme Court's decision on Roe versus Wade wasn't even relevant to her. However, her name on the affidavit set in motion the abortion debate that continues to erupt and divide across the United States of America. When Norma McCorvey lent her name to the cause, Roe versus Wade became the most controversial case in history. But in her time, many people believed that a fetus wasn't a person, so it did not have any legal right to life. But today, members of the scientific community can prove that life begins at conception, and a fetus has its own DNA. A fetus is a person and should have the right to life at any stage of pregnancy. But the Reproductive Freedom Act says a fetus shall not have independent rights under the laws of the state of New Jersey. This Reproductive Freedom Act is a shocking, disturbing bill that allows abortion up to the point of birth. It allows non-physicians to perform abortions. It allows conscience protections for medical workers to be eliminated. It allows pregnant teenagers to abort their babies without notifying parents. And it deletes language in the current law that would require an investigation and autopsy for a fetal death occurring without medical attention. The language in this bill will render the New Jersey Safe Haven Infant Protection Act obsolete, which has saved the lives of 77 precious newborn infants in New Jersey since its enactment. The Reproductive Freedom Act to expand abortion is the most radical, egregious abortion bill that our legislators have ever been asked to consider in New Jersey. The legislation contains no age restriction for girls seeking an abortion. It includes this right to foster children, children who are wards of the state, and very young children with no protection for victims of self-trafficking or child abuse, which makes them vulnerable with no parental involvement requirement. Once again, the government wants to raise our children and take away parental rights. Parental involvement at a time like this is of utmost importance, and parents should be contacted. The bill also removes hospital and ambulatory requirements for later-term abortions and permits non-physicians to perform abortions. This bill actually lowers the standard of care for women, especially those in the later stages of their pregnancy. And under this law, abortion procedures will be paid for by health insurance and taxes. This bill will apply to all residents of New Jersey and non-residents. It is disheartening to me that our state is at a point that we would even consider a bill that is so horrific. That is why I am so grateful for Senator Steve Orho, Assemblyman Hal Wirtz, and Assemblyman Parker Space for taking a stand and speaking out on behalf of the unborn. The innocent deserve a voice and protection under the law in the state of New Jersey and across the United States. With that, I want to thank everybody who has stayed on so that they can have public comment period, which I'm about to open right now. So can I please have a motion to open the floor for public comment on this resolution?
Fantasia, so moved.
Second?
Yardley, second. Yardley,
Any
second.
discussion? All in favor, please signify by saying aye.
Aye.
For the public that are online that want to speak on this resolution, we have opened the floor to your comment. We will ask you to first state your name and municipality. Then our clerk will create a list and she'll call each of you in the order received, and comments are limited to 3 minutes. So could you please just say your name and municipality one after another?
Randy Opitz, Hopakon.
Thank you. Next.
Tracy Boyle, Hopakon.
Thank you. Next.
Gail Opitz, Hopakon.
And next.
Valerie Leonard, Stanhope.
Next. Okay, Cherry, do you have those names? There are 4 people that like to make comments. Okay, so Cherry is going to call you each, and then you have 3 minutes, and thank you for your comments. Go right ahead, Cherry.
Our first caller is Randy Opitz from Hopakon.
Yes, thank you for taking my comments. I not only believe abortion is morally wrong, but there is also another way of looking at it. Financially, by having abortions, we are killing off our future. People that would be buying and selling goods, paying taxes, contributing to society. Only God knows how many aborted babies would have become scholars, doctors, inventors, even the president. My wife and I adopted our second daughter, and why not put more money into adoption agencies instead of abortions? Thank you very much.
Thank you very much for your comments. Terry?
Next caller is Tracy Boyle, Hopakon.
Yes, thank you for allowing me to speak, and I thank you for acknowledging our veterans. My husband is one, so I thank you so much for that, too. I just, as you were speaking, as you guys were talking, I just couldn't hold my tears back. It was really very emotional to hear this stuff. And I am so shocked and heartbroken that we even have to fight something like this. And, of course, I'm totally against abortion. Immediately, it's murder. That's all I can say. It's murder. And how anybody can kill a baby, a human being, that is ludicrous to me. I just can't get my mind around that. And to have, as a mother, to have my child, if she were to be pregnant, not to even know that she was pregnant and then have an abortion, that just makes me sick. It just makes me so sick. It's just crazy. And the least of it, but imperative, that our hard-earned money is allowing this. We are paying this taxes and allowing them to murder these babies on our hard-earned money. I mean, that's just blood money as far as I'm concerned, and we should have a right to know where our monies are going to. I don't want to participate in this. I never did. So, whatever I can do and whatever we can do to sever this, I'm on board, and, I'm there, number one, to help. So thank you very much for allowing me to speak.
Thank you for your comments. Appreciate it. Terry? Terry there?
I'm sorry, I was on mute. My candy wrapper's too loud. Sorry. Our next caller is Gail Opitz from Hopakon.
Thank you.
Yes, hello. I am convicted to think that God is not happy with abortions, for one, because He's a creator, not wanting to see things killed. that he creates. But to kill an innocent baby that hasn't even done anything, that's pretty bad, especially when it's on its way out of its mother's womb, is pretty awful. And I can't believe people are hoping to have the right to do that. Also, if we could think many years ago, there wasn't this option available. And yet, if there was, none of us would be here probably. Okay, if our mothers were in that situation, and it was pushed like it is right now, we wouldn't even be here. That's another thought. But also, I do understand that maybe some people have fear of, if they've gotten pregnant and then they don't know what to do and they're scared and worried and everything. I've met so many people over the years who could not have children, and they're very upset about it. And yet I hear of other people who are able to have them so easily and then just want to toss them in the garbage can. The solution would be for them to put them up for adoption. And these days, with that one program where they can go and put the child there in I don't know what building or whatever they'd have to go to, but I forget what it's called. But I do know that they are there to take a baby to give it for adoption, without even asking the name. So I think that's a perfect program to help people with those situations. And then that way the child gets, a home and is alive, and it saves the other person for their heartache and their situation. So anyway, I would like to see more of that being thought out instead of us taxpayers paying for terrible crimes of killing babies, innocent babies, especially at late term. That's just not good. Babies do feel the pain. We know that now through what we see, on the doctor's information that they have currently, So anyway, that's it. Thank you for allowing me to speak.
Thank you very much. Yeah.
Okay.
Our last caller is Valerie. And Valerie, I'm sorry, I just need your last name again, from Stanhope.
Yes, it's Leonard. It's Lehnert.
Thank you very much.
You're welcome. Yes, I'd just like to reiterate almost everything that you've all been saying. This bill is so horrific, and I cannot believe that anybody in their right mind would try to put something like this through and to pass it. It seems like this is just pure demonic or evil. I don't understand how anybody could want to kill even just in the womb but all the way to 9 months. And what they do when they are that old is totally, I don't even want to explain what they do, but I've heard it, and it's just, it wrenches my heart to think that these children are being so brutally murdered. Even through abortion, they just take them out piece by piece. It's so brutal that it breaks my heart. But to think that anybody in the state of New Jersey has thoughts like this, and that they would allow anybody, even not a doctor, to perform what they would call an abortion. But how do we know? Somebody off the street can say, well, I see this woman who's pregnant and I don't want her to be pregnant. I'm going to do an abortion on her. It just opens the door to so many other things that I just agree with all of you that it is just horrendous, and I pray that it will not pass in New Jersey. Not even, to say our taxpayer dollars would go towards that. And what Tracy said, that would be blood money, and I don't want to have anything to do with that. there's be blood on our hands if we allow this to go through. So, yeah, I just thank you for giving me the opportunity to talk and express my frustration over this. Thank you.
Thank you, Valerie. Are there anyone else that would like to speak on this resolution? Okay, I would like to thank all of you that waited so patiently to give us your comments. Greatly appreciate all the things that you said. And right now I'm going to ask the Freeholder Board to give me a motion to close this public session, but then I'm going to open up another public session for everything other than things that are on the agenda, anything you want to ask us on the agenda. So could I just have a motion from the Freeholder Board to close the public session on the resolution, please?
So moved, Hertzberg.
Okay, second. I have Hertzberg, and then I have
second.
Okay, thanks. Okay. All in favor, please signify by saying aye.
Aye. Aye.
Okay. Now I'm going to ask the Freeholder Board to give me a motion to approve resolution to oppose a pro-abortion / pro-sex trafficking S-3030/A-4848 resolution as read. So can I have a motion to approve that resolution?
Fantasia, so moved.
Second, please.
Second.
Okay. Terry, would you take a roll call vote, please?
Freeholder Fantasia?
Yes.
Freeholder Fasano?
Yes.
Freeholder Hertzberg?
Yes.
Freeholder Director Patillo?
Yes.
Freeholder Yardley?
Yes.
Okay, thank you very much. And thank you for those who spoke. We greatly appreciated your comments. Now at 21, I'm going to open for another public session from the floor. And at this public session, you can ask any question you'd like to ask. It doesn't have to be about the agenda. And again, we're going to do it the same way by taking names and municipalities, and then we'll make a list and call on each one, and comments are limited to 3 minutes or less. So again, Freeholders, could I have a motion to open the floor for public comments on all general questions? Have a motion, please?
Anthony.
Okay, thank you, Anthony. Got a second?
Yardley, second.
All in favor, please signify by saying aye.
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 Okay, the motion holds and the public session is now open. Is there anyone who is on this line from the public that would like to ask any questions or speak on any issues? Please just give us your name and your municipality. Okay, not hearing anyone, could I please have a motion from the board to close the public session?
Fantasia, so moved.
Okay, all in favor, please signify by saying aye.
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 Number 22 is a reminder to please check the county's website at www.sussex.nj.us for meeting schedules. Number 23 is executive session. Terry, could you please read that for us?
Yes, I can. Whereas the subject matters about to be discussed may be excluded from the public portion of the meeting by resolution of the Board of Chosen Freeholders as an exception to the Open Public Meetings Act pursuant to NJSA 10:4-12B, and whereas it appears necessary for the Board of Chosen Freeholders to discuss such matters in executive session, now therefore be it resolved that the Board of Chosen Freeholders of the County of Sussex, in accordance with the provisions of NJSA 10:4-12B and NJSA 10:4-13, that the Board at this time enter into an executive session from which the public shall be excluded, and be it further resolved that the general nature of the subjects to be discussed relate to the following items authorized by NJSA 10:4-12B as designated below. Item 7, I'm just looking. Item 7 is appropriate for various appointments, or it should be 8 for employment relationship.
Hold on a minute, Terry. What do you think, Greg?
Terry, I would leave it as... Yeah, go ahead.
I'm sorry. I think it's more fitting as 8. I think it was listed erroneously under 7.
Council is saying that it should stay as 7, and I would also ask the board to just add under number 6, emergency preparedness in COVID-19 pandemic.
Okay. Be it further resolved that the deliberations concluded in closed session may be disclosed to the public upon the determination of the Sussex County Board of Chosen Freeholders or provided by law that the public interest will no longer be served by such confidentiality. And be it further resolved that upon completion of the business for which the board has entered into executive session, question, will the board reconvene and resume its meeting open to the public, or will the board adjourn from executive session?
We'll adjourn from executive session.
Okay, and be it further resolved that the board expects not to take formal action and therefore will adjourn from executive session.
Okay, thank you. Could I have a motion to adopt the executive session resolution and enter into executive session?
Fantasia, so moved.
Second, please.
Yardley, second.
Okay, all in favor, please signify by saying aye.
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 Okay, again, I want to thank all of our public that called in and stayed with us for this entire meeting. We are going to adjourn into executive session, so our public session is over. And again, we appreciate your comments. Thank you. Bye.